Hi everyone, I'm Christopher, Heather's son, and the founder of Heather Cutler Foundation. I wanted to take this time to say thank you to the over almost 830 of you who have taken the time to sign our petition. Your support means a lot more than I can express. When my mom, Heather, was diagnosed with pancreatic cancer, we initially trusted the system. At first, it seemed like things were going well. Her chemotherapy was working, and we had every reason to be hopeful. But it wasn't long before we hit roadblocks. Access to somatic testing was delayed because her oncologist, based on experience, felt too few patients saw actionable results to justify the cost. So it was up to us, sorting through options on our own, staying up late to organize possibilities into an air table, and applying for trials on our own. We fought really hard to stay ahead, asking for treatments that honestly should have been standard. During this time, we sought second opinions. Twice, a specialist in Toronto reassured my mom that she had already surpassed expectations by making it this far and advised her to make peace with things. I'll never forget when she broke down on the phone telling the doctor, "I'm not stupid, I know it's in my momentum." She wasn't ready to go, and we weren't ready to back down. We believed in the possibility of more options, and we kept pushing forward. Towards the end, through family connections, we made it to Johns Hopkins in Baltimore, where we found a glimmer of hope. There were clinical trials happening in the summer that targeted her specific mutation, and for a moment it felt like we were back on the right path again. But by then, the cancer had progressed too far. Things went downhill very quickly after that. It was a matter of a couple weeks. 5 months after her passing, I can't help but wonder, what if we had made it to Baltimore sooner? There were too many missed opportunities along the way. My sister and I asked her oncologist to start her on pancreatic enzymes, something simple that studies had now shown improves survival, but they were never proactively offered. A nerve block that could have erased her dependency on opioids. By the time it was suggested, the tumor had grown too large, making that procedure impossible. We spent months navigating a healthcare system that should have been there to guide us. Instead, we were often delayed, dismissed, and left fighting for every bit of care that she deserved. We learned never to make assumptions or trust in the system. That's why this petition matters. No family should have to take on the role of an oncologist just to access care. We need national guidelines to ensure that patients receive the testing, trials, and the treatments that they need, regardless of where they live in Canada. It's not enough to have trials available only in major cities. We need remote access solutions to make these trials available across the country. Programs like CRAFT and Health Canada's proposed clinical trial modernization offer hope, but they need meaningful investment to truly make a difference, and they are very far off. And patients can't wait. We need more solutions now. Over 500 people, no, at this point 800 people have signed the petition, but we need more voices. We can't change what happened to my mom, but together we can build a better system, one where no patient is left behind. It's actually such a simple process. Provide every patient with uniform guidelines on the latest best practices. If my mom's story resonates with you, and I would hope sometimes that it doesn't, because I don't want any other family to go through what we went through, please add your name and help us make sure that nobody else has to go through what we did. Sign the petition. Every signature brings us closer to real change. For more on my mother's story and our advocacy work, please read our intro to advocacy series or check out our site at heathercutler.ca.